Hey guys, welcome back to my YouTube channel. Dr. Sam Al-Ghazawi, sports medicine orthopedic surgeon. Today we're going to talk about PRP, or platelet-rich plasma. It's a pretty hot topic. It's getting a lot of popularity, but the thing is, it's been around for a while. It was actually developed in the 1970s, first used for open heart surgery, then kind of transitioned to maxillofacial surgery. We used it initially kind of for complex wound closures or things that were not going well, but the use and the expansion of indications has kind of been rapid over the last couple of decades. So for me, for orthopedic surgery, for bones, joints, ligaments, we kind of focus on a couple different things that can be beneficial from PRP therapy. Another name for it, some people call it prolotherapy or proliferative therapy. It's all the same, doesn't matter. The point is, you're trying to use your body's own cells to help the healing process or change the environment of what's going on with your particular injury. PRP itself stands for platelet-rich plasma. So the idea is that we are taking platelets that are floating around in your blood, concentrating them, and then injecting those concentrated platelets into the area of interest. The reason for that is that platelets are kind of the signaling cells. They release a lot of factors that induce other cells to do things or recruit other cells to the area, again, that's injured or that has an issue. And they're the first cells that you kind of see when you have a cut. They're the ones that are clotting. They're the ones that are saying, hey, listen, body, we got to respond here. We got something going on. So the theory is that we can harness the platelet's potential to heal in other parts of the body. Where do we get PRP? We get it from your blood. We take your blood, spin it down, concentrate it so we get just the platelets, and we separate those out and then use that to inject the area that is injured or of interest. So there's a lot of misinformation. There's a lot of myths that I kind of debunk in the office. The thing is that we don't really truly understand at the fundamental level where PRP works or how it works, but we have some idea, and then we kind of take those ideas and we apply them to different injuries and different problems. So some of the most studied issues in orthopedics anyway are knee arthritis and tennis elbow. Tennis elbow being lateral epicondylitis, or the tendon that extends your wrist on the outside of your elbow being inflamed in a chronic situation. But honestly, we do it for any chronic tendonitis. We do it for arthritis type situations in multiple joints. It's almost like the modern day snake oil salesman. You're doing it for everything. There's a lot of, like I said, claims on the internet about what it can do, and honestly, there's a lot that it can't do. And I think part of it is educating people on expectations on PRP, and again, understanding that we don't fully understand how it works. You know, another misconception about PRP is that PRP are stem cells. They are not stem cells. So like I said, PRP is platelet-rich plasma, and we're just concentrating the platelets and having those cells kind of do their job. And they're really just signaling cells that are trying to elicit your body's own response, which are separate from stem cells, which can, in theory, turn into other cells and regrow tissue or heal injured or chronically injured tissue. So what we think for chronic tendonitis situations, for something like tennis elbow, is that we're injecting those platelets in a concentrated fashion in that area, and that's helping recruit your body's own potential and cells to heal. There's a lot of different kinds of PRP too, which is kind of what muddies the water as far as research goes, but research for tennis elbow has been pretty consistent that it does help with tennis elbow and chronic tendonitis at the lateral epicondyle. It's at least better than injecting saline, and also can help shorten the duration of lateral epicondylitis. As far as knee arthritis goes, you know, again, we don't really understand why PRP works. What we think is happening is that when cartilage is breaking down, which is the process of arthritis, it changes the environment in your knee. There's a cascade of events that are happening that cause inflammation and subsequently pain. What we think is going on when we inject platelet-rich plasma in your knee is it changes that environment. So maybe it changes that cascade of events or that feedback loop on why you're having pain. And there's also a lot of research that's been done on PRP compared to saline, compared to steroids, compared to gel injections, or what are called hyaluronic acid. And PRP seems to be superior kind of compared to all of them, if not as equal to at least the gel injections, but definitely superior to the other ones. So, you know, it's not regrowing cartilage. There's not evidence to support that that happens, but at the end of the day, it's about your symptoms. It's about your ability to get back to activity. And for me, being a sports medicine surgeon, it's about getting you back to being active in whatever that capacity might be. I think it's a great adjunct to a lot of treatments. I think that there's still a lot that we need to know and learn about how PRP works. I like having those conversations with patients, because if you're informed and your expectations are at the level that they should be for these kinds of treatments, you can make an educated decision as to why or if PRP is good for you, or if other treatments might be better for you. If there's more questions about PRP, if you have situations that you want to discuss, feel free to reach out. Otherwise, if there's other questions or topics you want to hear about, feel free to leave it in the comments, and we'll see you on the next one.